Hello everyone! I had the objective to describe the major differences and similarities in occupational therapy services provided in various settings. Pediatric occupational therapy can be seen in many different settings throughout the United States. However, the most common settings for pediatric occupational therapy are the public school setting, private outpatient setting, early intervention in the home setting, inpatient setting, and outpatient hospital settings. There can be many differences and similarities between these settings. For example, occupational therapy in the public school setting is considered a related service, not a primary service. A related service is defined and funded by the Individual with Disability Education Act as all developmental, corrective, and supportive services required for a child with a disability to benefit from special education, which in this case is the primary service. This means OTs in the school setting are only able to provide educationally relevant interventions to children, even if that child might need other interventions. It is not uncommon for children receiving OT services inside the school to also receive some form of outpatient therapy as well. Occupational therapy in private outpatient settings have a strict mission of providing OT services to the child, but also to the family as a whole. The goals and interventions for the child are developed by the occupational therapist, as also by the family. OT in this setting will usually work alongside other therapy professionals to improve child's play, education skills, occupations, childhood roles, and activities. It is common for private clinics to be a particular diagnosis, a type of intervention, or strictly a certain type of therapy. This setting is funded by insurance, or families pay out of pocket for the services. Early occupational therapy intervention in the home setting is provided to children ages birth to 3 years old, as well as for their families as a whole again. Much like school-based therapy services, early intervention therapy is also mandated and funded by the Individual with Disability Education Act. This act emphasizes that early intervention therapy is used to prevent primary and secondary problems with disabilities. Occupational therapy in inpatient settings focus on stabilizing the child's medical functions. Hospitals are by far the biggest provider for therapy services for children. This setting will have clients with acute, subacute, and chronic conditions. Interventions will support the primary goal of the client and often include splinting, feeding, controlling the environment, day-to-day activities, play, and social interactions. Interventions must meet requirements for public or private insurers who fund the therapy services. Occupational therapy in outpatient hospital settings can provide services for short or long-term care. Short-term care usually involves a follow-up for a child that was recently discharged from the inpatient setting. Long-term care usually involves rehab or specialized services for a child. Again, interventions must meet requirements for public or private insurers who fund therapy services. So even though there are many differences and similarities between pediatric occupational therapy settings, there will always be two main similarities between all OT settings. And the first is that the content of OT services is always provided to the client based off of the source of funding for that particular setting. And then secondly, and most important, all occupational therapy settings always work to provide their pediatric clients with the best therapeutic services to try to make a difference in that child's life. I hope you found this helpful. Thank you.